Hi, my name is Dr. Eunice and I'm a general consultant dentist in Penang Adventist Hospital. So as a general dentist, I do treat patients from all age group, but I do have special interest in treating young kids. So today we'll be discussing about children's dentistry. So your first dental visit can be as young as when your child is 1 year old. So some parents might be thinking, what can the dentist do when my child is 1 year old? Well, early dental visit is very important so that early identification and prevention of any dental disease can be done. So we will focus on conservative management. So when you bring your child in for regular checkups, we will monitor the growth, health, and also development of the oral cavity. So your child's first primary tooth, also known as the baby tooth, will start erupting into the oral cavity when your child is 6 to 9 months old. So during this time, you will find that your child is gums is very irritated and they tend to bite on a lot of things. So some little tip is to buy some teething rings or teething toys, put it in the fridge, chill it for a few hours, and then give it to your child. This will highly elevate the sore and the itchiness on the gums, and the child will feel much better. As parents, we should clean our infant's child right after milk feeding. So even before the tooth has erupted into the oral cavity, parents can use a wet gauze to wrap around their finger. So this can be used to clean the gums and the oral cavity and the tongue of the baby. When the first tooth erupts into the oral cavity, it will be time to get a small toothbrush and also some non-fluoridated toothpaste. So brushing for twice a day, once in the day and once right before sleeping is recommended. Well, we all grow up liking sweets as kids. So it would be quite brutal of me to tell any parent not to feed kids any sweets. But there are some tips and ways to take sweets and keep our teeth caries-free. Number 1, choose your sweets wisely. Sticky food are always more cariogenic than less sticky ones. For example, caramel is very sticky. So when the caramel sticks on the tooth, it will cause caries much easier. The next tip is to keep cariogenic food to meal times only. For example, if you want to eat a bar of chocolate, you have to eat it right after lunch or right after dinner. So, in between meal snacks can be kept to more healthy food like nuts, cheese, or fruits. This will highly reduce the caries rate of teeth. Other than that, rinsing right after taking sweet food is also very important. This is done so that sticky food does not stick on the teeth and caries does not happen. So the last tip is to have regular checkup with your dentist every 6 months. This is done so that the dentist can make sure that the oral cavity is healthy. Yes, habits like thumb sucking and sucking on a pacifier can actually cause a very big effect on the growth of the child's teeth. So, the growth of our jaw is actually in a very neutral zone in between the forces of the tongue and also the forces of the cheek muscles. So when a child is sucking on the thumb or the pacifier, this will cause a muscle imbalance and unwanted forces. So due to the muscle imbalance and unwanted forces, the shape of the jaw will change and will not grow naturally. So what do you do if your child has already been sucking on its thumb and you couldn't stop it? Well, there are certain appliances which can help to break an unwanted habit, but it's always better if a pacifier is not introduced to the kid from the start itself. So actually, it's very common for a young kid that when the kid falls, the tooth actually falls out. It either breaks or it falls out as a whole. So first is not to panic. Then, the parent or the teacher should actually find the pieces or the tooth. Try to pick the tooth at the crown, which is the white portion of the tooth, with a handkerchief. Gently rinse it with clear water. If possible, the parent or the teacher can help to place the tooth back into the socket and get the child to bite on a handkerchief. That means try to find the hole in the mouth and then put the tooth back in and then bite on a handkerchief. If not, we can take a small container and soak the tooth in some milk, saline, or even the patient's own saliva. Immediately send your kid to the dentist. So if you can actually rush your kid to the dentist within 60 minutes, it's a very high chance that the doctor can actually save the tooth.